On Wednesday, April 2nd, the Fort Hood Army Base in Texas was rocked by a shooting that left 4 dead and 16 wounded. Since then, military officials reveal that the alleged shooter was being assessed for post-traumatic stress disorder. Recently, Lisa Harrison, an APRN at Natchaug Hospital, spoke about PTSD, what causes it, and how it is treated.
Post-traumatic stress disorder, or PTSD as it's commonly known, is a disorder that happens to some people who have been through traumatic experiences. The traumas can be anything from abuse, car accidents, war, sexual assaults, workplace violence, anything where the person feels afraid, horrified, things like that. It's a collection of symptoms that kind of fall into 3 different categories. There are re-experiencing symptoms, there are hyper-arousal symptoms, and there are avoidance symptoms. PTSD tends to happen to people who've been through traumas. Anybody really can be affected by PTSD. But it's very common in people who've served in the military because they've been exposed to wartime traumas. It's common in people who have suffered from abuse, whether it's domestic violence or some other type of abuse. PTSD tends to run in families, and so they think that there's probably a genetic component. At times the person might seem a little detached. Other times they might be irritable or even explosive for little to no reason. They might report having nightmares, having trouble sleeping. They might seem on edge, almost like they're waiting for the next bad thing to happen. They might have flashbacks. They might seem things might not seem as fun to them as they used to. They might want to avoid talking about the situation. They might avoid people or places that remind them of the thing that happened. PTSD in the military and in other places is being addressed kind of through a 3-level approach. There's primary prevention, where they're screening people at risk for PTSD so that people who are at risk can get early treatment and intervention. There's secondary prevention, which is providing the early treatment. And then there's tertiary prevention, which is continuing the treatment and making sure that people recover. PTSD is generally treated with therapy. There are different types of therapy that can be used for PTSD. Cognitive behavioral therapy is one that's commonly used. PTSD can also be treated with medications. Antidepressants are things that can be used to treat PTSD. Zoloft and Paxil in particular are good for post-traumatic stress disorder. There are other classes of medications that also can be used. Group therapy also can be effective.